I'm Judy Peters. I'm from the United States. I'm Vice President of Health and Wellbeing at the Waters Senior Living in Minnesota. I have a nursing degree, and I've been a nurse for more than 30-some years, and currently I'm practicing in a senior living environment. From early on as a nurse in my training, we were always taught to look at the patient, quote unquote, as an individual and as a person, but how that person related to their environment. And you can never take the person out of their environment. And so often in our healthcare system, we're required to look at the person as a disease, an illness, a limitation. But what we've come to know in practice and just in life, that's not the way people operate. People don't always show up with their situation at a hospital. They live every day in their environments and they work. And so I guess in my learning and what I've applied throughout the years of my practice is to meet people where they're at. You know, in the traditional world, treatments and procedures, you think medications, you think wound care. In our integrative world, we think massage, use of essential oils, prayer, presence. Those are all treatments. So if we can get a data model that we can provide to nurses to use on an everyday basis where they can click a box that they've done massage or click a box that they've used essential oils, we can then be able to give voice to this integrative work that we're doing on a day-to-day basis. So what we do in our environment is when someone first moves in, we engage with them in getting their life story. It's not about an assessment, because an assessment right away is a pass-fail type thing. And we don't want people to feel that this is a failing process. This is a gift. If you get to be 70, 80, 90 years old, you've done something right. And we want to leverage that and bring that forward. So in this time of transition and getting Rose's life story, we learn about Rose. We learn that she journals. We learn that she has a real connection to people. However, now she's moving into this place that she doesn't know. So she withdraws a little bit. So what our staff does is they use what she does have strength with. She has strength with her journaling. She has strength with communication, verbal communication, and she has strength in doing laundry. So you set up the same processes for self-care, getting dressed, you take the clothes out, you put it into steps. And that's an example of taking the time to be present in someone's space, to meet them where they're at, and to make it so that they can be successful in a whole different environment and being person-centered and relationship-based. People who struggle with cognitive impairment, to not live confined in any kind of way, that we have a real open system that recognizes the gifts that people bring to the table, no matter where they are in the continuum of health, whatever supports they may need, that we don't look at them as services being applied, but amenities being offered, and that they have choice. That people might not be living the way that we would define as quote unquote normal, but they're living well. And that's what we have to recognize and value in a new way, and not try to label it in the traditional way. So my dream would be to walk the walk with people, and to be able to be present to them in their own time and space for whatever it is that they need to make them well.